Hey, my name is Becky Williams. I am a nurse at the University of Kansas Health System in Kansas City, Kansas. I work on the medical surgical ICU there that has now been converted into the COVID ICU. I just got off work. It's Tuesday, April 14th, and it was a hard shift. Our unit is full of very, very sick people right now. Almost every single patient is on a ventilator, and almost every single one of those patients on a ventilator is what I would classify as being very, very sick. They are on multiple medications that sedate them. They are on medications to help control their pain. And then because of those medications that they're also on medications to keep their blood pressure up. And even still, it just doesn't seem like we can get these patients better. It's been a very, very rough few weeks since we've converted into the COVID ICU. The first patients that we saw that had COVID-19 were some of the sickest patients that I've ever seen, and it honestly just kept getting sicker from there. I've been exhausted every single day coming home from work. I come home, get my scrubs off immediately, obviously, and I pretty much just collapse on the couch until going to work the next day. I think I maybe sat down for about 10 minutes today to shove a piece of pizza and a cupcake into my mouth, and then I ran right back out there to get back to the patients. I was the resource nurse today. We are super, super lucky at KU because they have actually staffed in a resource nurse to help out with the other nurses with just basically all the stuff that they have to do with these patients. So our nurses are still taking their normal patient load. They're taking 2 ICU patients at a time. And then luckily I get to be there, and we have a charge nurse there that kind of run around and help out. And, honestly, even with an extra staff member there to help out, it still just does not seem like enough. It still seems like we are just constantly running, constantly putting out fires, constantly trying to fix things. It just seems never ending. I just want it to end so badly. I am lucky though. I am very lucky because the team that I work with every day, they are resilient. They are amazing providers, amazing nurses, respiratory therapists, speech, occupational, physical therapists. I mean, I truthfully work with some of the strongest healthcare providers in the entire world, in my personal opinion. And if we had a different team, I don't think that we could get through this together. I'm so proud of how much we've accomplished, and how well we've taken care of these patients, even when it doesn't seem like we have enough staff, enough supplies, enough time. We have just taken this on and have not slowed down. And I am just so proud, and I'm so happy to work with the people that I work with. What is concerning, we have been receiving emails, gosh, I would say almost daily, just about the things that are running out and the things that we're low on. It started off first actually with medications that we're low on. Typically we use fentanyl and propofol or Precedex when somebody is on a ventilator and they're very sick. We use fentanyl for pain control, and then we use propofol and Precedex to sedate them, keep them calm, because being on a ventilator is just super uncomfortable, and can be really, really scary. So typically we run with those medications to keep the patient calm, keep them breathing with the ventilator. However, honestly, within, I would say, a week of us turning into the COVID ICU, we got an email stating that fentanyl was on a national shortage and that we would not be able to do fentanyl drips anymore. After that, we got another email saying that propofol was on a shortage and that we shouldn't be using as much of that. And then the next best medication we started to use was Versed. Now Versed is on a shortage, and then Dilaudid was on a shortage, and Nimbex, a paralyzing agent, was on a shortage. And I just don't know how we can run without these medications when they're all on a shortage. It does not seem possible, but we are making it work as best as we can. As for supplies, luckily we haven't run out of those yet. We get an N95 mask every shift. We use that, and we get a different gown every single time we go into a patient's room. I know a lot of other hospitals aren't that lucky, so I truthfully do feel blessed and very, very safe being there, knowing that I get an N95 for myself and I get a gown for myself every time I go into a patient's room. I feel very, very safe. But I know it might not always be that way. So honestly, all of us are we're prepared. We are just prepared for the absolute worst. We're prepared for just a disaster to hit. We are hoping every single day that won't happen to us, but I am frightened that it will.